7 Common Night Habits that Worsen Prostate Health After 60, and How to Prevent Them for Restful Sleep. As men age, prostate health becomes an increasingly important aspect of overall well-being. By the time many men reach the age of 60, benign prostatic hyperplasia (BPH) or an enlarged prostate becomes a common concern. While there are numerous factors contributing to prostate issues, one often overlooked area is our nightly routine. Certain nighttime habits can significantly impact the prostate and, in turn, disrupt sleep. In this comprehensive guide, we will explore 7 common night habits that can worsen prostate health after 60 and offer practical tips to help you maintain a healthier prostate and get better sleep. 1. Late-night fluid intake. One of the most direct contributors to nighttime urinary frequency is excessive fluid intake before bed. Drinking too much liquid, especially within 2 hours of bedtime, can strain the bladder and lead to frequent nighttime urination, also known as nocturia. For men with an enlarged prostate, this can exacerbate discomfort and disrupt sleep cycles. To prevent this, aim to taper off fluid intake during the evening. While staying hydrated is essential, try to consume most of your fluids earlier in the day. If you're thirsty at night, take small sips rather than drinking full glasses. Additionally, avoid beverages that act as diuretics, such as alcohol, coffee, and tea, especially in the evening. 2. Caffeine consumption. In the evening, caffeine not only stimulates the brain and disrupts sleep, but it also irritates the bladder and increases urinary urgency. Many people are aware that caffeine can affect sleep, but fewer realize its impact on the urinary tract, particularly in older men with prostate issues. Caffeinated beverages such as coffee, tea, cola, and energy drinks should be avoided at least 6 hours before bedtime. Instead, opt for herbal teas like chamomile or peppermint, which can help relax the body and may even promote better sleep without irritating the bladder. 3. Alcohol use before bed. While some people believe that alcohol helps them fall asleep faster, it actually leads to fragmented sleep and increases the need to urinate at night. Alcohol acts as a diuretic and can irritate the bladder, making it a poor choice for men with prostate concerns. Reducing or eliminating alcohol intake in the hours before bed can improve sleep quality and reduce nighttime trips to the bathroom. If you do choose to drink, keep it moderate and finish several hours before sleeping. 4. Inadequate bathroom routine before bed. Rushing through your evening bathroom routine or failing to fully empty your bladder can lead to more frequent trips during the night. Men with an enlarged prostate may experience difficulty with complete bladder emptying, which compounds the issue. Take your time in the bathroom and use techniques that encourage full urination. This can include sitting instead of standing, which may help with better bladder emptying, or using a double voiding technique. Urinate, wait a few minutes, and try again. Being mindful during this process can significantly reduce the chances of nocturia. 5. Poor diet and late-night snacking. Diet plays a critical role in prostate health. Consuming spicy, acidic, or fatty foods late at night can irritate the bladder and digestive system. Additionally, obesity is a risk factor for BPH, and late-night eating contributes to weight gain. Avoid heavy meals within 3 hours of bedtime. If you need a snack, choose something light and prostate-friendly, such as a small handful of pumpkin seeds, a banana, or low-fat yogurt. Focus on a diet rich in vegetables, fruits, healthy fats like omega-3 south, and whole grains. 6. Lack of physical activity during the sedentary lifestyle contributes to poor circulation, weight gain, and increased inflammation, all of which are linked to prostate problems. Additionally, Lack of physical activity can lead to restless sleep and more nighttime awakening. Incorporating regular, moderate exercise into your daily routine can improve both prostate health and sleep quality. Aim for at least 30 minutes of brisk walking, cycling, swimming, or other forms of low-impact aerobic exercise most days of the week. Exercises like yoga or Tai Chi can also reduce stress and promote relaxation. 7. Ignoring signs of sleep disorders or prostate issue. Snoring, insomnia, or excessive daytime fatigue can be signs of underlying sleep disorders like sleep apnea. Similarly, frequent nighttime urination, weak urine stream, or pelvic discomfort could indicate a worsening prostate condition. Ignoring these symptoms not only affects sleep, but can also signal more serious health problems. If you experience any of these signs consistently, consult with a healthcare provider. They may recommend a sleep study, urologic evaluation, or lifestyle interventions that can help address both sleep and prostate health. How to build a prostate-friendly nighttime routine to support prostate health and improve sleep quality. Consider implementing the following nightly routine. Set a regular bedtime and wake time, even on weekends. Consistency helps regulate your body's internal clock. Limit fluids after 7 p.m., especially diuretics like caffeine and alcohol. Choose light, bladder-friendly evening snacks if you're hungry. Engage in relaxing activities before bed. Reading, meditation, gentle stretching. Create a sleep-conducive environment. Keep your bedroom cool, dark, and quiet. Empty your bladder fully before going to sleep. Avoid screens for at least 30 minutes before bed to reduce blue light exposure. Nutritional support for prostate health. Certain nutrients can be particularly beneficial for prostate function. Zinc, essential for prostate health, found in pumpkin seeds, nuts, and legumes. Lycopene, a powerful antioxidant in tomatoes, watermelon, and pink grapefruit. Vitamin D, linked to a reduced risk of prostate disease. Get it through sunlight and fortified foods. Omega-3 fatty acids, found in fish like salmon and sardines, help reduce inflammation. Saw palmetto, a herbal supplement that may reduce symptoms of BPH in some men. Always talk to your doctor before starting new supplements, especially if you're on medications. Advanced strategies for long-term prostate and sleep health. Maintaining prostate health and achieving restful sleep after 60 involves more than just avoiding harmful nighttime habits. Long-term strategies, particularly those integrated into daily life, can significantly contribute to improved urinary function, hormonal balance, and overall vitality. Here are several extended approaches and deeper insights to further strengthen prostate and sleep wellness. Understanding the prostate sleep connection. The prostate is a small gland that plays a major role in male reproductive health. As men age, this gland often enlarges, pressing against the urethra and affecting urination. These changes are commonly accompanied by nocturia, waking up one or more times to urinate during the night. Nocturia not only reduces sleep quality, but also signals potential underlying health concerns. Chronic sleep disruption due to prostate-related nocturia contributes to fatigue, irritability, reduced mental performance, and even heightened risk of chronic diseases like hypertension and cardiovascular issues. Therefore, taking a proactive stance on both front sleep and prostate health can enhance quality of life. Lifestyle adjustments for prostate support. Weight management. Obesity is strongly linked with increased risk of BPH and prostate cancer. Maintaining a healthy weight through balanced nutrition and regular exercise helps lower pressure on the bladder and promotes better hormonal balance. Quit smoking. Smoking negatively affects circulation and has been linked to more aggressive prostate conditions. It also disrupts melatonin production, Reducing sleep quality. Quitting can bring measurable improvements in both prostate health and sleep within weeks. Stress management. Chronic stress elevates cortisol levels, which can worsen inflammation and disturb sleep cycles. Techniques such as deep breathing, mindfulness, journaling, or talking with a therapist can help regulate your stress response. Reducing mental strain helps relax pelvic floor muscles and may decrease urinary urgency. Limit exposure to toxins. Environmental toxins, especially those found in plastics, pesticides, and some personal care products, contain endocrine-disrupting chemicals that may influence prostate health. Opt for glass or stainless steel containers, organic produce, and natural grooming products whenever possible. Sleep hygiene for older men. Sleep hygiene refers to habits and practices that support quality sleep. Older adults often struggle with falling or staying asleep due to biological changes, medication effects, or conditions like BPH. Implementing sleep-promoting behaviors can help reduce nighttime awakenings and support deeper sleep. Monitor your sleep environment. Your bedroom should be cool, around 65 degrees Fahrenheit or 18 degrees Celsius, dark and quiet. Consider blackout curtains, white noise machines, or an eye mask and earplugs. The right mattress and pillows can also reduce pressure on joints and improve comfort. Develop a wind-down ritual. Establish a routine that signals to your body that it's time to rest. A warm shower, calming music, a gentle book, or aromatherapy with lavender can help transition your mind from alertness to relaxation. Evaluate medications and prescriptions, including diuretics, blood pressure medications, and antidepressants, may interfere with sleep or increase urination. Discuss with your doctor if evening doses can be adjusted to reduce nighttime disruption. Daylight exposure. Natural sunlight helps regulate your circadian rhythm, the internal clock that governs sleep. Try to spend at least 30 minutes outdoors daily, preferably in the morning. Complementary therapies and monitoring pelvic floor exercises. Kegels. Strengthening the pelvic floor muscles can improve bladder control and reduce urgency. These exercises involve repeatedly contracting and relaxing the muscles used to stop urination. Acupuncture and massage. Some men find relief from prostate symptoms and improved sleep through complementary therapies such as acupuncture or therapeutic massage. These approaches may enhance blood flow, reduce stress, and promote muscular relaxation. Regular screenings and proactive monitoring. Annual visits to a urologist are recommended for men over 60. PSA tests, digital rectal exams, and ultrasound evaluations can help catch problems early. Early detection of prostate issues often leads to better outcomes with less invasive treatments. Case study: John Storajon, a 64-year-old retired teacher, began waking up 3 to 4 times a night to urinate. Frustrated with sleep deprivation, he sought advice from his physician. John reduced his evening fluid intake, cut out caffeine after lunch, and started a regular walking routine. His doctor also prescribed a mild alpha blocker to ease urinary symptoms. Within 3 months, John reported waking up only once per night and feeling more refreshed each morning. John's story underscores how small, consistent changes can yield significant improvements. Addressing both lifestyle and medical factors allowed him to take control of his health. Future considerations: hormonal health and prostate wellness. Testosterone levels naturally decline with age, but imbalances in hormones like estrogen and dihydrotestosterone (DHT) can contribute to prostate enlargement. Maintaining hormonal balance through a nutrient-dense diet, regular physical activity, and minimizing alcohol and processed food intake supports both prostate and sexual health. Some men may consider hormone replacement therapy (HRT) under medical supervision, though this approach requires careful evaluation of benefits versus risks. Putting it all together, a daily plan for prostate and sleep health: morning, wake at the same time daily, including we can spend time outdoors or near a window for natural light. Eat a balanced breakfast rich in fiber and healthy fats. Afternoon, hydrate consistently, but begin tapering fluids by late afternoon. Exercise or take a walk to improve circulation. And mood: eat a light, nutrient-rich lunch. Evening, finish dinner at least 3 hours before bed. Avoid caffeine, alcohol, and heavy or spicy foods. Practice a calming bedtime routine. Empty bladder fully before sleep. Conclusion: health after 60 requires conscious lifestyle choices, particularly when it comes to nighttime habits. Seemingly simple actions like drinking too much water before bed, enjoying a glass of wine late at night, or ignoring signs of urinary issues can gradually contribute to discomfort and sleep disruption. By identifying and adjusting these 7 common habits, you can take proactive steps to improve your prostate health and enjoy more restful, uninterrupted sleep. Make these changes one at a time, and be patient with yourself. Your body will thank you with better rest, improved urinary function, and greater well-being in the years ahead. Final thoughts: addressing prostate health after 60 is a multifaceted endeavor, but the rewards are significant. Improved urinary function, deeper sleep, and greater energy levels contribute to a richer, more fulfilling life. Rather than waiting for symptoms to worsen, proactive adjustments to your habits, environment, and medical care can ensure you remain in control of your well-being, whether you're already experiencing symptoms or simply aiming to preserve your health. The strategies outlined in this guide provide a strong foundation. Remember, consistent small changes often lead to the most profound and lasting results.